Hypothyroidism is 5 to 10 times more common in women than men, and it isn't just about low thyroid hormones. Inflammation is a major root cause that is driving this condition. Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to health and hormones, and welcome to the Wild Wisdom Show. Today, we're going to be talking about the link between inflammation and hypothyroidism that could be your key to a healthy thyroid. Now, the important thing to understand is when I'm talking about inflammation, we need to know that it's your body's natural healing response. It's helpful in the short term, but it's very harmful when it's chronic, when it persists, and when it starts to target certain parts of the body. Chronic inflammation is that long-term inflammation that can occur in any organ. So it can occur in the skin, in the eyes, in the brains, in the ovaries, testes, and in the thyroid. And it can cause some trouble in the thyroid when that inflammation starts to kick in that very important organ. Root causes of inflammation include an inflammatory diet, poor sleep, stress, toxins, and a sedentary lifestyle. And the fact that inflammation is driving hypothyroidism is a recently discovered phenomenon. And in fact, they fuel each other. So if you have inflammation, it can cause hypothyroidism. And when you get hypothyroidism, it drives more inflammation. So it's a very important understanding to have, and that this is proven in the research. However, in research, they're able to measure inflammatory markers that your doctor cannot measure in the clinical setting. Markers like interleukin 7 and MIP-1 beta, these are inflammatory markers that can trigger inflammation in the thyroid. And again, this is not something that your doctor can detect on blood work. And likewise, when you have hypothyroidism, you get more inflammation, which can be measured through markers like interleukin 6 and TNF alpha. Also things that your family doctor can't easily measure, doesn't have access to in the clinical practice. So we have to rely on the research findings to understand that when we start to have problems with our thyroid function, we need to look at inflammation. What are the drivers of inflammation? And some common signs that you have inflammation impacting the thyroid include fatigue, so feeling low energy, weight gain, even though you haven't really changed what you've been doing with your diet and your exercise, hair loss, and always feeling cold. And when you have hypothyroidism that is then driving inflammation, you can actually get other non-thyroid effects. So the inflammation caused by hypothyroidism causes an increased production in other markers like CRP, C-reactive protein, and as mentioned, that interleukin 6 and TNF alpha. And these can negatively affect your heart and your blood vessels, and it can damage the lining of your vessels. And so what that can do is it can increase your risk of getting a heart attack or a stroke. It can cause some metabolic changes, make you more likely to, again, gain weight, get hypertension, high cholesterol, and diabetes. And it can cause reproductive inflammation. So depending on where you are with your life stage, maybe you are in your fertile years, that can cause problems with fertility. Perhaps your menstruation will be affected. Maybe your perimenopause will be problematic with a lot of symptoms. And also your menopause could not be your golden years because you're getting a lot of issues with that inflammation. So what does this mean for you? Hypothyroidism is more than just low hormones. It means that you have to start looking at inputs of inflammation, things that are driving inflammation in the body. And that is the key to your full body health. So lifestyle solutions include an anti-inflammatory diet, better sleep, stress management, getting enough movement and exercise, not too little and not too much. And in some cases, looking at specific supplements. But remember, you cannot out-supplement an inflammatory lifestyle. And unfortunately, that is the kind of lifestyle that many of us have settled into because we didn't know when we started to eat certain foods or behave in certain ways that these things would cause inflammation in the body. So a lot of it is learning new things to adjust your habits and your lifestyle so that you can reduce inflammation and feel better. It's a two-way street with hypothyroidism. When you manage inflammation, you improve that hypothyroidism, which in turn improves inflammation. So that's how you can get yourself out of that vicious negative cycle into the positive cycle so that you don't only just protect your thyroid, you protect your whole body health. Now, if you're wondering at this point, what do I do to decrease inflammation. How do I eat? What are some supplements? I highly recommend that you check out my inflammation playlist on my YouTube channel. That's Dr.Patricia Mills MD is the name of my YouTube channel, and subscribe. That's the best way to support the Wild Wisdom Show so I can continue to provide you high quality information. If you enjoyed this episode, save it for future reference and share it. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. So I look forward to seeing you next time. I hope you have a wonderful rest of your day, evening, or night, depending on when you catch this, and put your questions in the comments. I look forward to hearing from you. Bye now.